This video is for anyone who is trying to navigate infertility, whether you are just starting to try, you have been trying for a while, or you are in the middle of fertility treatment like IUI or IVF. My name is Dr. Rebecca Gibbons. I am a licensed acupuncture physician and registered nurse here in Pensacola, Florida, with over 20 years of patient care experience. Fertility is one of the conditions closest to my heart because I have seen how isolating this can make women and couples and how isolating the journey can feel. But at the same time, I've seen what real support and acupuncture can really do. So let's start with what acupuncture actually does for fertility because there is real research behind this. Acupuncture has been shown to improve blood flow to the uterus and ovaries, which supports a healthier environment for conception. It can help to regulate the hormones involved in ovulation and the menstrual cycle, and it has a measurable effect on stress. So it lowers cortisol, which matters immensely because chronic stress can interfere with reproductive hormone signaling. And when you're having trouble conceiving, your stress just increases. Also, there is a growing body of research specifically on acupuncture alongside IVF, looking at things like uterine lining thickness and implantation rates. The results are promising, though every patient's situation is different. I want to be very clear about something. Acupuncture is not a replacement for reproductive medicine. If you are working with a fertility specialist, that relationship matters. I don't want to take that away at all. And I always encourage patients to continue that care if they feel like that's the path that they want to go. What I offer is also a complement. Many of my patients are going through IUI or IVF at the same time they are seeing me. We coordinate around their treatment calendar, timing sessions, around egg retrieval, transfer, and other key points in their cycle. The more we see you, the better the outcomes. The goal is to support your body to be in the best possible state for conception to occur, whether that happens naturally or with medical assistance. I also want to talk about something that does not get talked about enough, the emotional toll of infertility. So many of my patients tell me they feel isolated and stressed. They feel like they cannot talk about it with friends who are getting pregnant easily. They feel like their body has failed them. I want you to hear this clearly, though. Your body has not failed you. Fertility is complex, and struggling with it does not mean something is wrong with who you are. Part of what I provide in our clinic is simply space to be heard. Treatment time becomes a place where patients can talk about what they are going through without judgment or without rushing. In terms of expectations, I typically recommend acupuncture consistently, at least for 3 months before and during fertility treatment cycle, because that gives the body time to respond. Some patients come to me pregnant from a previous cycle and want support through their pregnancy. Others are just beginning their journey. So what I can promise is that you will have a partner in this process who sees the whole picture and who will support you in every step. If you are navigating infertility and you are looking for support, whether you are just starting out, whether you just have questions, or you are deep into treatment, or you have been trying for many times, and maybe have had miscarriages, I would love to talk with you. You do not have to do this alone. Call us at 850-530-1028 or visit us at adela.com. If you feel like someone else may need to hear this today, please send this to them or subscribe for further information.